was not talked about. And of course, it's an unpopular subject, getting brain damage from scuba diving or commercial diving. But what happened was, and again, the story in the book, and the reason I wrote it was I was at a crossroads and had given my senior partner a year's notice that I was leaving the practice and likely the field of medicine if something did not change for me, because I was out of residency. I really didn't know. I didn't have any direction, and I was somewhat lost. And I sat down with myself and said, listen, you got to change your attitude. You determine your life, the direction, the decisions you make. And I delved into the diving medicine and what was going on in the brains of these divers. And in the midst of it, a number of these unbelievable cases came up, which are described in the book. The one guy who was going to kill all the diving company management over his brain injury. The other one who was in a jail on a psychiatric hold, essentially committed because he had tried to kill himself, and secondarily then accused of murder falsely. Just crazy, unbelievable cases, but two guys whose lives were essentially over. One that was likely going to die in a gun battle with police and so on, and the other one who just was going to kill himself. And I took a flyer, if you will, and applied something that Dr. Richard Neubauer had done and been heavily criticized for, which was treating their brain injury at a lower dose of hyperbaric oxygen than what had been accepted in the entire field, and was even considered by the definition, maybe not hyperbaric oxygen. And these guys not only got better, it totally turned their lives around. And it was so compelling and had such an impact on me that it completely changed my life. Neurological disease, and especially chronic neurological disease, is untreatable. That's what every doctor is taught, at least my generation. And here, these two, if you will, throwaways, they were neurologically unretrievable, unsalvageable, and it totally saved their life. The one guy went on to live, another 20 years, died at the age of 65. I just found that out recently. The other one, though, is still going strong, went and got 2 master's degrees and does cognitive testing for traumatic brain injury patients in a major hospital program in West Texas. And when I saw this happen, I realized that this therapy, which had been so mischaracterized, unknown, et cetera, was unbelievable. And the medical profession had really missed it, had been completely misled because they didn't understand it. And so as the cases started accumulating, patients getting referred, cerebral palsy children, people with stroke, trauma, the first boxers, which was a project of my senior partner, I felt by 2005, 2004, I was so filled with this information and wanted to get it out that I went about seeing if I could write a book. And the message was to patients. It's buried in chapter 12, Roadblocks to the Future. And it just tells people that I presented the evidence for this in acute severe traumatic brain injury, showing that you can reduce mortality by 50% with just a few treatments right after the injury. And yet here we weren't using it. And the conclusion was, we can't trust the medical profession at the institutional level to do what's best for us medically. You have to go out and find therapies, find what you need, and be in control of your medical future. And that was the message. And I just wanted to spray this information out to the world, shout it from the tops of every mountain. And that's how that book got written. And the title of it, The Oxygen Revolution, was from my wife, Juliet. So the book went out, and what had happened, lastly, to get to your other point, once this discovery was made, I embarked for 10 years on a project to find out what else this could be used for, what other neurological condition, because here I was treating what was the foundation diagnosis for this subspecialty, hyperbaric and diving medicine. decompression sickness. But what I was treating was chronic brain injury. These were long after the accidents, months and months afterwards, considered untreatable in hyperbaric medicine. What else in the chronic brain injury, genre could this treat? And so for 10 years, I looked at every neurological patient and diagnosis that got self-referred or presented to me. And I realized that you can't do everything, that to really make an impact and make a contribution, I had to focus on one thing. And of all of those diagnoses, the one that seemed to respond the best, besides brain decompression sickness, was traumatic brain injury. And so the focus began on that. And then all of the presentations and interface with the federal government, the Department of Defense, all, CMS, the FDA, on and on and on. And to finally do the studies, to put the evidence in front of the medical profession that this is probably the most effective therapy for traumatic brain injury. Acute, subacute, chronic, severe, moderate, and mild. All severities, all acuities. And so that's where we are today.
Wow, this is amazing. It's such a powerful message to the medical community and to patients. Because as you said, nowadays, you cannot trust medical institution with decision on the treatment. You really need to do your own research. This is one of the reasons I really wanted to record this podcast, to make this information available to people who are suffering from neurological disease, from the consequences of traumatic brain injury, so they learn that this therapy is in fact available and that they can go to their medical provider and ask about it, because this is where it all starts. If we don't ask for the treatment, a lot of times, unfortunately, it is not being offered because, as you said, doctors are not being taught in medical school. It starts there. Very few hours on hyperbaric medicine, if any, mostly on diving medicine, goes very much unnoticed. Some strange specialty, how doctors treat it, maybe for people who really like diving or ocean and things like that, where in fact it's such a powerful tool. And as you said, it's the #1 therapy for traumatic brain injury.